Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening to you. Welcome. This is Health Matters, as you've seen. I'm Khawa Solomon. Shukran so much for joining us. And please do stay with us as we highlight World Diabetes Awareness. Everywhere around the world, that's what they're talking about for the entire month of November. Alhamdulillah, it is a common disease and we hear about it often, but do we really know and understand what it's all about? Pre-diabetes is also something that we will be chatting about, prevention, diabetes in children, pregnancy. So please do stay with us, and remember your questions will be answered throughout the show by our specialist. You can call us at the number on the screen, which will appear a little bit later on. And also, if you've missed any of the shows of Health Matters, catch it on our YouTube channel. For your family and friends listening to us across the lands and over the beautiful seas, they can tune into ITV Networks. They can stream itvnetworks.tv. Click on live stream. Let's welcome our guest. Assalamu alaikum, Dr. Shuaib.
Wa alaikum salam wa rahmatullahi wa barakatuh. How are you?
Looking well fresh this evening.
Yeah, thank you.
Not that you don't look fresh any other time. And we have our endocrinologist, Dr. Nasreen. Assalamu alaikum.
Wa alaikum salam. How are you?
I'm very well, alhamdulillah. Shukran so much for joining us. I know you've come a long way and we really appreciate your time.
Jazakallah for inviting me.
So let's start with you, Dr. Wadi. Diabetes, something that's very common, and you brushed your hair for the show, so we appreciate that.
Thank you so much.
But
it means I must brush my hair every week now.
Take us through an introduction for World Diabetes Day, inshallah.
So, I don't think that diabetes is actually one of those conditions that requires little introduction. I don't think there's somebody in South Africa that hasn't heard of it or doesn't know that there's an illness called diabetes. But really what diabetes is it's a metabolic disease. And maybe it'll be Dr. Mayuddin Nasreen can give us a bit more detail, but it's a disease where your body handles glucose or sugar abnormally because of a variety of reasons. Just to get to the basics in terms of diabetes, over many years now, diabetes has been separated into what we call type 1 diabetes and type 2 diabetes, and they really are separate diseases. So type 1 diabetes is a condition where it's an autoimmune condition. So when I say autoimmune, it means your immune system produces some type of substance or attacks your pancreas, which is where insulin is produced. It attacks the part of the pancreas which produces insulin, damages those cells, so your cells cannot produce insulin anymore, and you become diabetic rapidly over a few days to weeks. And typically, it's a life-changing catastrophic event, especially when it occurs in children. And it's quite easy to diagnose when it occurs in children because type 2 diabetes will sort of quite rarely affect children. So in children, it's the predominant type of diabetes. They used to call it juvenile onset diabetes. And what happens is the child is fine, is happy, and sometimes they have a viral infection, sometimes there's some other event, and they then get very sick over a few days, 2 weeks. Parents are puzzling about what's going on, and then they do some blood tests and check the sugar, and the sugar is through the roof, and the person is often acidotic or ketotic and very ill and needs to be in hospital, and it really is a catastrophic event for that family, and it's a lifelong challenge for those diabetics. And any type 1 diabetic will tell you that it's a life-changing event from that moment on. And there are many young people who are battling with that condition. Type 2 diabetes is a condition which used to be typically affecting people who are much older. It seems to be getting younger and younger nowadays, and is what we call a disease of lifestyle predominantly. Not exclusively, but predominantly. That means that's a combination of your genes, so some genetic elements, some type of underlying predisposition, together with a lifestyle which predisposes you to become diabetic. And maybe Nasreen can tell us a bit more about that.
Absolutely. Anything to add on? And also, if we can include why we should be highlighting, because it does need no introduction, but alhamdulillah.
I think Shuaib's done a great job in outlining what diabetes is. But if I could just take it back one or two steps, is that diabetes is really a disorder with how our body processes glucose. And glucose, all our cells need glucose as fuel. Insulin is the hormone that allows glucose to enter the cells. And diabetes can be caused by one of two things. Either we don't have enough insulin, like the type 1s, or our cells don't respond well to insulin, which is what the predominant problem with the type 2 patients is. And you may have heard of this as a phenomenon called insulin resistance.
Yes.
And that's, in a nutshell, how the diabetes comes about.
And these words that are used, glucose, insulin, sugar, does it mean the same thing?
So glucose is the simplest form of any sugar. So any sugar that we have taken in, whether it is in the form of starch or any other sugary substance, will ultimately be broken down as glucose in our bloodstream. But coming back to your question as to why it is important, is that diabetes is literally a pandemic in the world. In in the world, we have over 400 million people who are living with diabetes. And this figure is only going to rise in the coming years. In fact, over the next 25 years, this figure is going to increase by over 50%.
Sure.
The problem with it really is that the bulk of this disease burden is being driven by the developing world. And the bulk of the disease burden is being driven by sub-Saharan Africa. So not only is it a problem, it is a problem that is very close to home.
So, in your opinion, and looking at the world and also in South Africa, why do we need to highlight this disorder?
So I think that diabetes is a problem that is not really a disorder that is solely of glucose metabolism. Having a high blood glucose is only one aspect of diabetes. Diabetes runs in parallel with many other diseases. And if you know of patients who have diabetes, and I'm speaking particularly about type 2 diabetes, you will find that they often have high blood pressure or hypertension and an abnormal cholesterol level. And these are things that drive what we call atherosclerosis, the lining of our blood vessels with fatty plaques. And this is what drives cardiovascular disease and ultimately puts these patients at risk for heart attacks and strokes.
And we want to talk more about that, but let's look at the symptoms quickly, or rather how one can get diabetes. Are all patients with diabetes the same? You've mentioned type 1, type 2, children.
So diabetes can affect anyone. But as Shuaib described, there are the two categories, or the two broad categories, type 1s versus type 2s. The type 1s are usually younger. They are usually lean, so they're slim patients. And the presentation is usually sudden. The key difference, though, is because they are insulin deficient, meaning their pancreas is no longer producing the hormone they require, they need to be treated with insulin from the time of diagnosis. Whereas type 2 patients, we say that their presentation is insidious. This means it happens gradually, and they may not even realize when the onset first occurs. So they are often overweight, sometimes even obese. In fact, often obese.
Okay.
And their treatment depends on a variety of things. Lifestyle and dietary modification are essential in the therapy for type 2 diabetes, and then they require a variety of other additional medication.
Oh, there we have some explanation, type 1 and type 2.
I think one of the key differences in type 2 diabetes, as Nasreen pointed out, is that because it develops so insidiously or gradually, many people will not know that they're diabetic, sometimes for several years. So, and obviously there's a spectrum. So you start off with what we call sort of pre-diabetes, where maybe the sugars are a bit high after you eat, or when you wake up in the morning, they're a bit higher than they should be. So the fasting glucose and the glucose that after meals starts rising because the sensitivity of your cells to the insulin that your body is producing has changed. So many diabetics will be diagnosed with pre-diabetes, or what can become a common diagnosis today is what's called insulin resistance.
Okay.
That means it's a precursor to diabetic. They don't have the criteria required to diagnose diabetes, but they're well on their way to becoming diabetic.
So let's understand the symptoms to know whether we're walking around with it or not.
So first of all, patients may have no symptoms at all, which is why, as Shuaib said, you may not know for years that you have diabetes. But once symptoms do develop, these may include things like frequent urination, intense thirst, blurry vision, and when patients' sugar control is particularly bad, patients may have quite a lot of weight loss, even though they were overweight to start off with.
Rapid weight loss.
And recurrent infections. So many of these patients will develop infections of the skin or urinary tract infections or other infections where they were not getting them before.
Okay. So to watch out, what would be the predominant signs?
The urine, I think.
Yeah.
I think that would be obvious coming from Shoaib. That would be the urine.
To keep you going.
So I think it would be foolish to say there would be a predominant sign, and that is the real issue.
Okay.
Is that the people who are at risk, the pre-diabetic group, which Shoaib mentioned, they may have no symptoms, but there are certain groups that are at risk. And these groups, particularly the older patients over the age of 45, should be screened annually. It is worth checking your glucose on an annual basis to know if you do have a high glucose.
The other aspect that's important in terms of screening is only important if you can take action. So one of the things about diabetes, why it's so important, and comes back to the point that you made and Nasreen made as well, is that diabetes kills. So people who have diabetes, their lifespan is substantially shortened compared to people who are never diagnosed as diabetes because of a variety of organs which get damaged over time with the diabetes together with the other conditions which come together with diabetes. So the idea is if you pick it up early, you may be able to control it early and prevent the long-term side effects. And you may even be able to reverse early diabetes and go back to a pre-diabetic or non-diabetic state.
Sure, and we need to run that down and out with all our viewers, because the screening is of utmost importance when it is picked up, and not to delay that. So we talk more on prevention, what's happening during diabetes, and your questions just after this. Assalamu alaikum wa rahmatullah. A very good evening. Welcome back. We're talking about diabetes. It is World Diabetes Month, this whole of November. So keep this conversation going. We have specialists in studio, our kidney and endocrinologist, nephrologist, endocrinologist. Bit of a tongue tie. Dr. Nasreen and Dr. Shoaib, shukran and welcome back. So just before the break, we spoke about screening. What does that involve? And whether you have symptoms or not, you know it's in your family, but just the idea of wanting to go for a screen, what does that involve, and who would be at risk for that?
Screening for diabetes is fairly simple. The test involves a simple blood test, which can be done either fasting, in which case we can do a fasting glucose, or we could do a random glucose, meaning you do not have to be fasting, or we can do a test called the HbA1c. In all three cases, it is a simple matter of a single blood test, which can be done fairly cheaply and fairly easily.
Okay.
I mean, some of the blood tests can be done, especially glucose can be done with a pinprick, like a random glucose. It doesn't have to require you to go to the lab. So there are many screening days and screening clinics which are run by many organizations. The idea of screening is to look for something before you develop symptoms. To make sure it's not there. And that's the reason we screen for things like diabetes, hypertension, high cholesterol, many other things, breast cancer, the types of conditions, prostate cancer, the type of things we've discussed in the past on the show, is to try and detect them early before they cause severe damage. So similarly for diabetes, you want to screen at-risk groups. So you wouldn't really be screening for type 2 diabetics, teenagers. Because the risk is small, and they will be much more likely to get type 1 diabetes, which is often very symptomatic, so there's usually not a delay. But somebody above the age of 40 could quite easily be diabetic without knowing it for several years. And if you can screen that population and pick up people who are asymptomatic and give them the opportunity to make a change in either their lifestyle or take medication, you may actually prevent complications years down the line.
So let's latch on to those that are at risk. When visiting your doctor, it's usually your GP. What do you need to disclose to them?
So I think your doctor would like to know your risk profile. So they would like to know firstly what your family history is like, and not just a family history of diabetes, which of course would be important, but also a family history of the associated diseases like high blood pressure, cholesterol abnormalities, heart attacks or strokes, particularly if these occurred in a family member at a very young age. And then, of course, they would look at your personal risk, whether you're a smoker, whether you have a normal weight, whether or not you're overweight. And all of these things would put you at an increased risk. One of the other things to look at, particularly in in women is whether or not.
And some of those are on the screen at the moment.
Oh, there we go.
Okay, so great. That's
that you've mentioned.
So, like we said, the obesity and the family history of diabetes, and then there are certain high-risk ethnic groups, particularly people coming from the Indian subcontinent, so people of Indian and Pakistani descent have a particularly high risk of diabetes, in fact, one of the highest in the world.
Sure.
Patients who have an association with any of the metabolic diseases such as high cholesterol or hypertension, and women who have had diabetes during pregnancy or have delivered a baby who is over 4 kilograms may have suggested that they will have a higher risk of developing type 2 diabetes later on in life.
Okay. So is this the information that you should know? And what else should you be following within your history, whether it is diet, lifestyle, or family, that you need to disclose as well to your
So first
doctor?
of all, if you fall into any of these categories, you should have an annual screening for your glucose.
Okay.
And if you fall into the pre-diabetic range, you should institute immediate measures to try and reverse these. In fact, probably even before you fall into those range, if you are a high-risk group, you would want to start preventing the onset of diabetes, because the risk of developing diabetes can be as high as 50% a year.
How do you know that you're pre-diabetic?
So, I mean, you can do some of those screening tests, and some of those screening tests will come up in the range of pre-diabetes. So, for example, the Diabetes Association will have different cutoffs for what's a normal fasting glucose, what's a glucose that's in the pre-diabetic range, and what's a glucose that's clearly diabetic for a fasting glucose. And similarly, postprandial and after meal glucose, what's clearly diabetic, what's not diabetic, and what's in between. So you understand that there's a continuum. It's not an all or nothing story. Similarly, if you are pre-diabetic but you have lots of other risk factors for cardiovascular disease, you may actually almost want to treat yourself as if you are diabetic. So the threshold for therapy for different groups may differ based on your other risk factors as well. And you can still have a normal glucose when you test it. But when you check the insulin levels are much higher relative to where they should be. And that's sort of a fairly sensitive or earlier test. There's some controversy surrounding how accurate they are and how much you should use them. Lots of general practitioners and others use them. But there are indices you can do which will suggest that you're at risk for insulin resistance.
Let's hear Dr. Nasrin.
I think one of the take-home messages that Shoaib is giving you is that diabetes is very much a numbers-driven disease. Right? And in fact, we often tell patients to know their diabetes numbers.
Know your numbers.
You have to know these numbers, and there are targets at which these patients are treated to.
When you talk about numbers, what does that mean?
So I think two simple things to remember. A fasting glucose between 6 and 7 suggests that you are pre-diabetic.
6 the evening and 7 the
No.
So,
If you get up in the morning before you've eaten breakfast and you do a finger prick and your sugar is more than 6 and less than 7, you are pre-diabetic.
And if it's more than 7, you are diabetic.
You are diabetic. Not a touch of diabetes or not slightly diabetic, you are diabetic.
So, I mean, this is not rocket science. We live in the 21st century, most of us. You can Google this. You can take out your phone and say, what glucose makes me diabetic? And then you can also look at what numbers you should be aiming for. And then you can also look at other things, you know.
Are there other conditions that makes the factors of understanding the numbers difficult? For instance, it will give a false reading. Somebody with thyroid or any other conditions.
So there are lots of analytic variables, but I think for general use, if you had to get up in the morning and have a high glucose, that is a sign that a patient should be going into their doctor and be tested.
And be formally and properly tested.
Yeah. And certainly things like thyroid disorders or other chronic medical conditions don't interfere largely with a normal finger prick glucose.
Okay. So let's look at, Dr. Wadi, explain to us who needs to manage a diabetic patient.
So the first person who needs to manage a diabetic patient is the patient themselves. This is a responsibility that the patient has to take, and it's an understanding that they have to get. I mean, unfortunately, we live in a society where there are many people who will live their lives at a certain level or in a certain way, and when they get ill, they don't understand that some of the consequences of them getting ill is related to some things that they've been doing in their lifestyle, and that they can't address that underlying condition without addressing their lifestyle. So diabetes is very much a disease which is worsened and even caused in many cases by lifestyle.
That
What you
individual's
eat,
decision.
when you eat, how much you eat, whether you do exercise, whether you get sufficient sleep, what your stress patterns are, and other things. So there's many different variables which come in, and if you are diagnosed as pre-diabetic, for example, it's really an opportunity to look very deeply and carefully at your lifestyle, because at the pre-diabetic stage, a substantial proportion of patients may have reversible diabetes. Even at the diabetic stage, there's significant numbers of people who can improve their glucose control, normalize it with diet, exercise, weight loss, and sometimes they'll need medication. But once you
Sometimes they need medication.
Well, at the pre-diabetic stage.
Okay.
Once you're an established diabetic, and even some pre-diabetics, then you won't need medication to help you.
Okay.
We find a lot of people need medicines because it's easier to pop a pill than to change your life, which is not really the right mentality. And as you pay for the penalty for that as your sugar gets worse, because as your sugar gets worse, popping a pill often is not enough.
Yeah, absolutely.
So I just want to clarify, what Shoaib's saying is absolutely true, is that a healthy diet and lifestyle absolutely has the potential to improve your glucose levels. But once you have improved your glucose levels, this is not a license to go back to the original diet and lifestyle.
You'll become the same.
Yeah, so those changes need to be instituted forever.
So when would they need to come and see you then?
So I think if you have, whether you're pre-diabetic or overtly diabetic, under either of those circumstances, you should be managed under the supervision of a doctor, because even with good diet and lifestyle measures, because there is such a strong genetic risk to type 2 diabetes, there is always the possibility of disease progression. So it is not inevitable that the best diet and lifestyle will prevent the onset of diabetes.
So we spoke about medication. Let's look at the adverse effects and some side effects when they are taking medication.
Now, first look at the effects. I mean, it's very tempting to say, oh, you're going to get side effects of taking the medication, but you need to understand what the side effects are of not taking the medication.
Okay.
So we can go back, for example, to the HIV denialist age in South Africa, where the government said that if you take HIV medication, it's going to make you feel ill, you may feel a bit nauseous, and there's a risk of getting liver problems and nerve disease, so we won't give anybody HIV medications. And then we killed like 2 million people because we just didn't give them HIV medication. So the idea that you should avoid a medication which may be beneficial just because of the side effects which may happen is something which really we need to take people away from. They need to understand that these medications don't get registered because of the side effects. They get registered because there's some benefit to them, and then we need to look at the side effects and manage them if they develop them. So that was a shouting
Dr.
for you.
Nasreen, so your advice when you're not wanting to take it.
So I think if we are going to start with the benefits, then what we have to understand is that the benefits of anti-diabetic medication, and whichever form they are in, whether they are oral or injectable, go beyond just controlling your sugar. And that's what that's the understanding we have now in 2019. Okay. And particularly with the newer drugs that are on the market, not only do they have the benefit of improving our sugar control, they may also have additional benefits like adding to weight loss, decreasing our cardiovascular risk. In other words, patients taking this medication may have a lower risk of having a heart attack or a stroke down the line, and also having beneficial effects on blood pressure. So I think there are multiple benefits to taking your medication, in addition to their most important benefit of lowering your blood glucose and making you feel better.
And we talk about not just what happens, but what needs to happen when you have to take your medication. We spoke about the heart, other conditions and complications that can happen. So your questions on diabetes just after this. Assalamu alaikum and welcome back. This is Health Matters, channel 347 ITV Networks. You can also follow this live show if you have friends and families anywhere around the world on the World Wide Web, itvnetworks.tv. Any of the shows that you've missed on Health Matters or ITV, you can follow our YouTube channel. I'm Khawa Solomon. With me is Dr. Nasreen and Dr. Wadi as we discuss diabetes awareness. So we've got a caller online. We are taking your calls live. Remember, if you are calling in, turn down your television set so we can hear you clearly and try and get to a part of the house where the signal is good. Assalamu alaikum. Good day. This is Health Matters. Yes, sir. Your question to the specialist?
Okay, I've got a question.
Yes, go ahead.
Is the fruit also is sugar in fruit harmful as well?
Okay.
The sugar is getting fruit.
Okay.
All right. Is
Is
that
that
your
your
question?
I've got another question.
Yes.
What about carrot? Does it cause from the eyesight? Because my sister-in-law is taking a lot of carrot and she got sugar. So I don't think that means
And she got sugar.
yes,
Okay.
Okay.
sugar, carrot juice, carrot juice.
Okay.
Juice. Okay. Thank you for your call, sir. Assalamu alaikum.
Okay.
If you are calling in, remember, please turn down your television set and try and get to a spot in the house where you have good connection so we can hear your question nice and
So
clearly.
I don't know if the
Yes, Dr.
listeners
Sheikh.
heard the question of the
Yeah.
viewers. So maybe the two questions we can repeat and then Nasreen can answer them.
So it is
The one is does
fruit?
fruit have sugar in it, and how does sugar in fruit affect your diabetes control? And the second one is can
carrot juice.
contribute to diabetes or cause diabetes,
diabetes.
because does it have enough sugar?
Dr. Nasrin.
So I think the questions are related, right?
Okay.
Is the sugar content in fresh fruit or vegetables enough to harm
Affect your sugar, yeah.
your sugar? And the bottom line is that sugar from any source, whether it is a natural source or an artificial source, will cause your glucose level to be elevated if you take it in large quantities.
Okay.
So if you have to have a large quantity of fruit and you test your sugar thereafter, you're going to find that you're going to have an elevated blood glucose. So I think the simple answer is that everything in moderation is probably fine, and anything in excess, even things that are supposedly healthy, like fruit.
So
Specifically, the question about carrots, I'm not aware if there's anything related to
how
carrots.
do you know
and
when the fruit
diabetes.
has a high sugar content? That you say
Sweet.
testing.
That's probably the simplest way to go.
Okay.
It's true.
Thank you, Dr. Wadi.
It is true.
I
I
could've
mean, what
answered
makes
that.
sugar sweet is not different from what makes sweet sweet.
Sure.
And remember, sugar is a plant product. So the sugar that you're putting into your tea or your coffee comes from sugar cane, which is grown as a plant. And then that sugar is refined and taken out, has a particularly high content of sucrose. So, but there is a reason fruits have sugar, to make people and animals want to eat them. And then you want to eat them, and then you disperse the seeds. So it's built into the mechanism of dispersal
cycle.
of those seeds.
So what are good sugars then that
But-
the diabetes?
So I think one
Okay.
of the points Shoaib highlighted here is that a large part of diet and lifestyle modification is common sense. If we know that something is probably too good to be true, that's probably it. It is too good to be true.
And carrots do have more sugar than some other vegetables because they are a bit
They're
sweeter.
quite sweet, yes.
So, for example, if you look at the Banting dieters and so forth, they actually advise that you stay away from carrots because they have too much sugar. So use rather green veggies and so forth. So there is sugar in some vegetables as well, like jam squash and so forth and so on. So you just need to be a bit moderate.
So let's now take a step back and go back to the question where management comes in. Let us then now understand who really does manage a diabetic patient when diet comes to play and understanding what you're eating.
So what Shoaib started off with is that the patient forms the center of the diabetes management team. Excuse me. But managing diabetes sorry about that. Managing diabetes really does involve a team approach.
Okay.
And it is always patient-centered, but the other team members would include the doctor, which may be a general practitioner, a physician, or an endocrinologist, depending on the needs of the patient. It would also include a dietitian, it would include a podiatrist, it would include the optometrist, it may include a psychologist, particularly for very young patients or patients who are having difficulty with coping with the idea of a chronic disease. And a very important person in the management of diabetes is the diabetes nurse educator. There are many aspects of diabetes that require someone's concerted effort to be able to understand and then to implement.
Okay.
And often any of the health professionals do not have the time to sit down with the patient to understand these
I see
these
nurse educator
aspects.
and doctors right on top.
So I think the nurse educator is an under-recognized component of the diabetes management team. And patients developing close relationships with nurse educators help them immensely, because nurse educators are able to address many of the other aspects of diabetes management as well.
And they'll scold you.
But I mean, I think what Nasreen says, the patient is the one living with the disease every day. You're not going to have the doctor holding your hand every day.
Absolutely.
The diabetes educator is key because they empower the patient to take responsibility themselves for their care on a day-to-day, moment-to-moment basis. And as I mentioned to you earlier, you can't escape your lifestyle even later on in the disease when it's established, even when you're on medication. You can out-eat your insulin. So if you can take so much insulin and eat more, your sugar still won't be controlled. So your diet, your medication, your activity, a lot of those things have to be synchronized and be done correctly in the right way. For example, if you take too much insulin and exercise, you could drop your sugar quite significantly.
Okay.
If you eat a lot and don't take sufficient insulin, it doesn't control your sugar. So those type of things have to be matched. And the patient is the one who's going to do that on a day-to-day basis, because we all know we don't eat the same things, the same amount every day. So we do need to have that education.
There we can see what the insulin is doing. Dr. Nasrin?
So the bottom line is that without insulin, in the long term, patients with diabetes will develop a variety of complications.
Okay.
Right? And these complications are basically complications that will affect either the large blood vessels or the small blood vessels. When I say large blood vessels, we are referring to the traditional cardiovascular diseases, strokes and heart disease. And when we are referring to small blood vessels, then we have blood vessels at the back of the eye, which can lead to blindness, blood vessels in the kidney, which would lead to ultimately renal failure, and then blood vessels which supply the nerves, which can lead to diabetic nerve damage. But untreated, an elevated blood glucose, while it might make you feel not so good in the short term, in the long term can lead to multiple organ systems being damaged.
Let's talk about the medication itself. We haven't touched on, some of the side effects. There has been a question that has come in, probably because of side effects, if there are alternatives to diabetes medication.
So let's start
from a viewer.
Let's start with the medication itself, right? So diabetes medication can be either oral or injectable. And most patients with type 2 diabetes would start with oral therapy and then thereafter move on to injectable therapy if the oral therapy is insufficient. Patients with type 1, as we mentioned, would start with insulin. And insulin is key from the very onset, and this is non-negotiable. I think for patients with type 1 diabetes, and this is the little children that Shoaib referred to earlier, there is no alternative.
And insulin is administered through injection.
At the moment, yes.
Yeah.
There's no other way at the moment.
But it is a subcutaneous injection, which means it's a very tiny injection which is administered under the skin.
Okay.
And the patient can administer themselves very easily. For type 2 diabetes, there's a variety of therapy available. And we are very fortunate in that in the last few years, there have been several new drugs that have become available in the world, but also these have become available in South Africa, which offer our patients many options in terms of therapy. Probably 10 years ago, we had 1 or 2 drugs, and then you would have to move on to insulin. Now that list has increased many-fold. So I think the first point to understand is that our therapy for patients with diabetes is not a one-size-fits-all approach. What you would need and how you would need it would depend on the patient's needs, and they would decide in consultation with their doctors.
I mean, also the target that you would aim for in every patient is not the same. So, for example, in younger people who have got who are quite healthy or pretty well, who don't have severe end organ damage or have no damage, type 1 diabetics, for example, you would be aiming for quite good tight sugar control, provided that they were able to deal with the one complication of tight sugar control is the sugars dropping too much, which can be a serious side effect. So I think in those patients who are motivated, you would aim to control the sugar quite tightly because it can protect your eyes, your kidneys, your nerves. Whereas in an 80-year-old person who's diabetic, who's maybe living on their own, or who's not very easily mobile, the risk of dropping the sugar is too high. That person can be found the next day unconscious. So you may not want to aim as aggressively.
And before you continue, Dr. Nasser, just quickly before we take a break, and I know this is a quick answer to the viewer's question: is there an alternate to diabetes medication?
To my knowledge, there isn't any alternative
Natural
that can be used independently.
Okay.
There may be therapies that may be complementary to the allopathic medicine, but I don't know of anything that can be used
independently. So you need to take your
independently.
medication.
I think that's
We'll
the simple
continue
answer.
after the short break. The discussion: diabetes awareness, a very common condition throughout the world and in South Africa. So please do continue watching. Assalamu alaikum and welcome back. This is Health Matters and our last few minutes of the show. If you'd like to partake, please call on the number shown on your screen. Remember to turn down your television sets. You know what? Move away from your TV completely if you're going to call us. So good connection spot, and move away from your TV if you want the specialist in diabetes to answer your question. Dr. Wadi and Dr. Nasreen, we still want to get to some of the special precautions to take and special individuals that categorize in diabetes. One is children, another is pregnancy. We know fasting and Ramadan is a big questions around people with diabetes. Let's start with children, inshallah. What do we need to know about their diabetes?
So we know that most children who have diabetes would be categorized as having type 1 diabetes.
Okay.
And this is devastating for families who have a child with type 1 diabetes for many reasons. One, to have a child with a chronic illness is obviously a huge issue for a family.
Yeah.
But secondly, it is a very difficult condition to manage in children because it affects almost every aspect of this child's life, from what they're going to eat for breakfast to whether or not they can attend a birthday party.
Yeah.
But probably the most feared complication with kids is the risk of their sugars running low, because children may not be able to explain the symptoms that they would have, and this is a real fear for parents living with a child with type 1 diabetes.
What do you mean they can't explain it?
So I think
A really small child can't say, I feel
patients
unwell.
with type 1
okay.
diabetes may be as young as 6 months old or a
okay.
year
You're
old,
talking about
and
the age.
they would
Okay.
be completely unable to explain what they're experiencing. And I think for this particular category of patient, they should be managed by a pediatric endocrinologist. This is not a category of patient that could be managed at a local clinic, by a GP, or even a physician. Or a pediatric endocrinologist is certainly warranted in this particular age group. Very young children with type 1 diabetes require very specialized care.
And the care makes a huge difference to them. How well they do, how they grow up, their lives as adults makes a big difference.
And I'm sure the primary caregivers has a lot on their plate at the same time. Can that responsibility be shared, and how well, does it need to be managed?
So I think families who have lived with type 1 diabetes have become incredibly resourceful. And there are amazing online support groups where these families have gotten together, and they have taught doctors a thing or two about how to manage type 1 diabetes. In fact, they have driven a lot in terms of the development of software and the development of devices to help these children with type 1 diabetes. So I think we shouldn't underestimate the power of a concerned parent. But
That parents living with their child 24/7.
Yeah.
But
Watching that.
having said that, I still think as far as medical care goes, this is not something that should be within the ambit of general care and should really fall within highly specialized care.
Pregnancy.
So as far as pregnancy goes, there would again be two categories. Those women who are diagnosed with diabetes and wish to fall pregnant. And it is not a contraindication, meaning women who have diabetes can have happy, healthy pregnancies.
Sure.
However, it is essential that they have good sugar control before falling pregnant, and this pregnancy should be planned.
Okay.
The second category is those women who fall into the at-risk group. We spoke about patients who may be at risk for developing type 2 diabetes. They may develop diabetes during pregnancy, and we refer to this as gestational diabetes. It is one of the reasons women who go for antenatal visits regularly have their urine checked. There are many things which their doctors are looking for, but one of these things is glucose. And if there are recurrent episodes of glucose in the urine, they need to be tested for diabetes in pregnancy.
Fasting in Ramadan, Dr. Wadi.
So, I mean, we've had shows on fasting in Ramadan before. And obviously, it's not a contraindication to fasting if you're a diabetic and you have good sugar control. In the past, it used to be said that if all type 1 diabetics should never fast in Ramadan. But many authorities have softened that approach now, because many type 1 diabetics do fast. And obviously, because they're type 1 diabetics from such a young age, they may never have the experience of fasting if you say they can't fast. So they really do want to fast.
Okay.
And there are ways that they can. We have many type 1 diabetics who do fast, but they need to obviously be aware of the risks and the possible complications, the risk of hypoglycemia. They may need to adjust the way they take the insulins. They may need to adjust the amount of insulin they take. So insulin-dependent diabetics may be able to fast, but with care. Non-insulin-dependent diabetics whose sugars are well controlled can also fast. Obviously, similarly, they may need to adjust their medication. They may need to take less medication. Sometimes take some of the medication at night that they would normally take in the day, especially because they're eating more at night. And then adjust the amounts of activity that they do during Ramadan. Who shouldn't fast for sure is insulin-dependent diabetics who have serious kidney disease. They should never fast. Insulin-dependent diabetics who are pregnant, or even non-insulin-dependent diabetics who are pregnant. Diabetics who have serious infections shouldn't fast. And any diabetic who's got very poor, what we call brittle control, that means their sugar's all over the place, they're putting themselves at serious risk of complications. The idea is to prepare yourself before Ramadan. Ramadan is not a secret. You know when it's coming. You understand what I'm saying? Unless you were in a coma for like Rajab Shaban, you know Ramadan is coming. So you should really prepare for it. And if you were in a coma, Rajab and Shaban, don't fast in Ramadan.
Dr. Nasrin, we've got a few minutes left in the show. What is the take-home message and some of the information and lifestyle changes with regards to preventing diabetes? Yeah.
So I think the first thing to understand is that diabetes is a common disorder, and the mainstay of therapy will always start with lifestyle and dietary modification. And this should start as early as possible and as soon as possible, not just for individuals, but even for their families.
But I think for our viewers, you need to be specific. So cut down on...
Live like a diabetic even before you're diabetic, from your lifestyle
which
perspective.
is, don't do sugar.
So I think it's not rocket science. High calorie foods, and not just a food that contains sugar, but any food that is high in calories is likely to increase.
Even a vegetable like potatoes.
Absolutely.
So balanced diet. Balance your plate, all the colors, fruits, regularly water.
Reduce calories. So calories in moderation, really. Most of us eat too much.
Okay.
So when you're having
junk food.
The dal chawal after lunch after Jummah on a Friday, you don't have to have 2 plates. You understand? It's a moderation.
Yeah.
Don't eat in the sunnah way. You don't have to fill your stomach up. Leave some space, leave some air in there. There's a message in that in terms of living your life in moderation. And then besides diet, you want to make sure you're not smoking. And that's just not for diabetes. But if you have diabetes and you smoke, it increases your risk several-fold. And similarly, you want to make sure that you're doing sufficient exercise, so you're physically active. Don't sit the whole day and watch ITV.
Okay, so the big question is, can it be cured?
So in 2019, there is no cure for diabetes. There are small subgroups of patients who have been able to restore their glucose to normal levels. And this has been with dramatic lifestyle changes and significant amounts of weight loss. But even then, this doesn't mean they were able to go back to their pre-diabetic lifestyles. Whatever lifestyle changes they initiated would have to be continued indefinitely.
Dr. Wadi, any advice on some natural medicines that are available that people are trying, homeopathy?
Well, look, I mean, there are lots of anecdotal reports. There are people who get something from somewhere, some relative gives them something with with so-called benefit. It's very difficult to tease out whether there's actual benefit. As you know, many so-called natural medicines or herbal medicines have never been tested. So as Nasreen was saying, you don't really have evidence to say that this will really control your sugar. And you don't know what side effects those so-called natural medicines have. And believe me, there are natural medicines which have side effects. You know, arsenic is a natural substance, but it can kill you. So can most heavy metals. They're all natural substances. But so I think that the reality is that if you're taking anything in your body, you must use some wisdom and some understanding. You may then want to watch your sugar, see what happens, and then monitor for other side effects. And especially if you've got serious conditions like kidney disease, liver disease, you've had cardiovascular disease, you may need to bear in mind that some natural medicines may interfere with some other medicines that you take, and you may not be aware. And your doctor is definitely not aware of how they interfere, because we are not trained for that.
So, how to educate ourselves, Dr. Nasreen? Any useful websites, safe books,
I think there's a wealth of information available, and a wealth of good information available on the internet and in books on type 2 diabetes. There are two South African organizations, the Healthy Living Alliance and Sweet Life, which is an organization which has an online magazine where there's a variety of information, both from a patient's perspective and from practitioners' perspective, including alternative medical practitioners' perspectives, which will give patients some sort of an overview. But, I mean, that would only be a start. I think there's a lot more information out there. And hopefully the patients will be able to educate themselves further.
Shukran so much, Dr. Wadi and Dr. Nasreen, for your time that you've afforded, and hopefully our diabetes and pre-diabetes, or like you said, Dr. Shoaib, live like a diabetic before you even are diabetic. We appreciate your time and your advice. And for you, our viewer, please, inshallah, keep this conversation going on diabetes awareness and change your lifestyle. Do some more exercise and be safe wherever you are. From myself, Hawa Solomon, watch out for next week's show as we do prophetic medicine. Very good evening to you.